Oh yes. Well, now when I met Archie Kalokerinos from Australia, he came over. Oscar had him over, and we started talking about these things, and we all observed the very same things that independently he had discovered in Australia, and I discovered here. Now he had the advantage of seeing more of these kids who really had acute induced scurvy. I mean, they were terribly scorbutic to begin with. So that's where his title of the book, Every Second Child, came along. Now, in this country, fortunately, we didn't have that much trouble. The kids don't have frank scurvy, but they sometimes will have problems. Now, Archie described this one case, that the exact same thing that he described happened to me. This had to be about 1975, is that this mother brought in her kid, who had a 2-year-old, who had a temperature of 104. And we gave him a penicillin shot just to be sure, despite the fact that I thought it was viral, and told him, mother, to give vitamin C and sent him home. And about 2 a.m. that night, I get this telephone call, and the mother says, I think he's dying. And I said, well, did you give him the vitamin C? No, he won't take it. He's 2 years old. So I said, well, meet me down at the office. And in the midst of the snowstorm, he came down. And here this kid was practically unconscious with his back arched. This is called episthetosis, and it's one of the symptoms of scurvy. And I was talking fast and drew up the sodium ascorbate and gave him a shot, 2 C's of sodium ascorbate in both buttocks. And before I could get the second shot completely in, he's sitting up looking around talking. It was just like that. And that kid would have been dead in a few hours. If I had sent him to the hospital, he would have died, I think.